So today we have a range of topics as I introduced to you earlier on. We are going to see the milestone of Tanzania laboratory services and institutionalizing the diagnostic excellence and quality assurance. And we are going also to pass through resource optimization and technology leveraging. And we know that we are in the technology era and artificial intelligence. That's where we are going to see how we can leverage on the technology that we have to improve laboratory services. We are going to hear laboratory voice, the impact of biosafety and biosecurity practices here in Tanzania. And we are going to hear about laboratory readiness on emerging diseases, on how we are going to respond, the outbreak investigation, and how we play a part on detecting these emerging diseases, pathogens. And later on, we are going to have a very wonderful topic on sustaining laboratory services systems and delivering beyond donor investment. And today, ladies and gentlemen, I'm happy to introduce to our panelists. And once I introduce them, I hope they are going to make their way in up here. Today we are glad and we are honored to have Dr. Grace Magembe. You can put your hands together for her. So Dr. Grace Magembe is the Chief Medical Officer, Minister of Health. Dr. Grace Magembe is distinguished Tanzanian public health leader with excellence and experience on practice, health governance, and policy. Her career spans senior leadership positions at subnational, national, and international levels, including Deputy Permanent Secretary at the Ministry of Health and President's Office, Regional Administration and Local Governments. She also serves on global and local boards, including the Lancet Commission on Disability and Global Health, Tanzania Social Action Funds, Antimicrobial Resistance Multi-Sectoral Coordination Committee, and Tanzania Health Summit. Here we are today. This just to mention the few. Dr. Magembe vision is central to shaping an integrated laboratory network that is adaptive, future-ready, and responsive to evolving public health needs. She holds medical degree, Masters in Public Health, and Masters in Business Administration from Eastern and Southern Africa Management Institute. Once again, ladies and gentlemen, let us put our hands together for the CMO while she's making her way here. Ladies and gentlemen, let me introduce you to Dr. Nzovo, the Director of Diagnostics at MDH. For the past 20 years, Dr. Nzovo has led various healthcare projects in Sub-Sahara, including HIV care and treatment, laboratory, TB services, malaria, health information systems, and health systems strengthening. In Tanzania, Dr. Nzovo has played a key role in scaling up viral load and aid testing services, EQA HIV rapid testing from 9% to 90%, creation of national laboratory system, sample referral system, accreditation over 70 laboratories, and development of national forensic evidence management guide for gender-based violence, establishment of DNA forensic laboratory at Forensic Police Bureau, and establishment of molecular biology laboratory at Temeke for testing infectious diseases. Dr. Olenga received a doctorate in biomedical services from Harvard School of Public Health in 2008, focused on HIV, viral genomics, dynamics that influence infection, disease progression, pathogenesis, and treatment outcome. Ladies and gentlemen, let us put our hands together for Dr. Nzovu Ulenga. Karibu. Next speaker will be Mr. Ambele Mwaflango, the Acting Director of the National Public Health Laboratory here in Tanzania. He is health laboratory scientist with over 16 years of experience in public health laboratory science. Mr. Ambele has played a central role in COVID-19 and MVD outbreak response, decentralization of COVID-19 PCR testing, spearheading National Public Health Laboratory accreditation for proficiency testing, establishment of MDH-Lab as Center of Excellence for Biosafety and Biosecurity in East African region, and the designated WHO Center of Excellence for influenza and HIV drug resistance testing. Mr. Ambele also is a certified Africa CDC trainer of biosafety and biosecurity, mentoring numerous of health laboratory professionals in biosafety and biosecurity, sample management system, and outbreak preparedness. Ladies and gentlemen, let us welcome Mr. Ambele Mwaflango. The next speaker today will be Mr. David Temba, works as a Senior Laboratory Service Manager for Laboratory Services for MDH-supported projects. He holds Masters of Science in Applied Microbiology from University of Dar es Salaam, with his first degree in molecular biology and biotechnology. He has extensive experience over 18 years working in various clinical research projects such as HIV, TB care and treatment programs as both as laboratory scientist and project manager. His passion is to transform the provision of medical laboratory services at all levels in the country and to establish national and international standards for the reliable and accurate diagnostics to effectively support clinical and research treatment services. Welcome, Temba. Let us join our hands to welcome Mr. Temba. He has been working tremendously in laboratory projects. The next and our last speaker for today will be Dr. Msafiri. Dr. Frank Msafiri is a clinical microbiologist at the Management and Development for Health, MDH, with extensive experience in research and public health program implementation. He has supported national efforts to combat the spread of antimicrobial resistance through strengthening surveillance systems, antimicrobial stewardship, and infection prevention control for health facilities. He has led at national surveillance of acquired HIV drug resistance using remnant viral load specimen. Dr. Frank currently is an investigator for the East African-led HIV drug resistance clinical trial, which explores the best way to manage dolutegravir resistance among clients receiving DTG containing antiretrovirus therapy. Karibu sana Dr. Frank Msafiri. At this point, we are going to start with Mr. Temba. Mr. Temba is going to present on milestones in Tanzania laboratory services, institutionalizing diagnostic excellence and quality assurance. I think we are going to hear a lot of information on laboratory services. We are going to see how we have adopted several best practices and the tremendous efforts that have been put in place by government and stakeholders. Karibu.
So good afternoon all. As been introduced, my name is David Temba, working with Management and Development for Health. So, and today I will be presenting on behalf of Dr. George Mgomela, who is the Associate Director of Programs for CDC. So, this presentation highlights key achievement, critical steps that Tanzania has taken to strengthen diagnostic excellences and quality assurance across Tanzania. So we sincerely thank all partners, our partners, particularly the Ministry of Health and CDC for their significant contribution in this work that I'm going to present. And we also extend our gratitude to the summit organizers for providing this platform which enable the public health community to recognize the milestones our country has made in strengthening diagnostic services with quality assurance. So think of aviation industry. Normally flights are kept safe, not by a single check, but by multiple layered safety systems. So from the flight checks to air traffic control to in-flight monitoring, aiming to protect passengers and prevent disasters. The same principle applies to laboratories. A quality assurance system acts as our safety layers, preventing mistakes that can harm patients and communities. In aviation, a small oversight may cause only to catastrophic consequences. So, and the same is true for the laboratory. Even a minor laboratory errors such as mislabeled sample, faulty test results, or missed control check can directly affect the patient treatment decision that will undermine trust in the health system and impact public health outcomes. So quality assurance in laboratories is not an option. It's a safeguard just like in aviation, and where every layer of safety protect lives. So accurate lab results are not just numbers on a report. They are foundation for the correct diagnosis which lead to effective treatment and improved patient outcomes. When both patient and clinicians can trust the results, they gain confidence in the entire health system. On the other hand, inaccurate results can delay treatment, lead to the wrong medication, increase cost, and in some cases also it costs lives. That's why we say quality assurance is not optional, it is essential and non-negotiable. Without strong quality systems on health system, without a strong quality assurance system on health system, health system can function reliably because patient care and the public health decision depend on trustworthy laboratory data. So Tanzania Diagnostic Network is organized in a tiered structure, similar to a hub and spoke system or model. So the spokes, these are the lower level laboratories, mostly dispensaries. They perform simple rapid tests such as HIV testing, malaria, and the basic diagnostics. And we have middle level laboratories that act as hubs. Usually they are health centers. They act as a near point of testing facilities with the ability to process more advanced tests, store sample and reference specimen to higher level laboratories when needed. And we have referral testing laboratories. These are higher level facilities such as regional or national reference labs. They conduct complex and specialized tests, including viral load, HIV drug resistance, molecular diagnostics for TB, and the other various tests. So the spokes enable early detection of diseases and immediate patient management, while the middle level, the hubs ensure continuity and timely lab results. So looking at this map, it shows distribution of laboratory at various levels. So we have spokes labeled as a black. We see there are so many. We have around 5,400 dispensaries across the nations. We have hubs at the level of health centers, which are around 323, and of course the referral labs, which are around 290. So Tanzania has achieved or has taken various steps that has led to the critical milestones in terms of diagnostic excellence and quality assurance. So before 2000 era, we had a basic and decentralized diagnostic services with very limited QMS, quality management implementation. So the initiatives that the country has taken between 2002 and 2010, whereby we have strengthened infrastructure, laboratory infrastructures and the system, specifically upgrading the lab buildings, starting from the regional hospital laboratories, the zonal up to the national and the referral laboratories. We also introduce sophisticated equipment to ensure that the upgrade that has been done also goes with the testing technologies. So between 2010 to 2020, we started implementation of quality management system to ensure that we set quality assurance measures that will guarantee the diagnostics services. These include the implementation of SLAMTA and accreditation program. So SLAMTA program just prepare the laboratories to undertake the accreditation journey to ensure by end of the year, of the day, they achieve international accreditation. We also instituted the EQA schemes, various EQA schemes for HIV-related tests, malaria, TB, and other various diseases of public health interest, to ensure that the quality of these tests that are generated, they are of high quality. We have also established designed and established a sample referral system and network transport network just to improve the access of diagnostic services to all levels, starting from the lower level, the spokes, to the hubs, up to the national level. Also, the curriculum at the school, laboratory schools have also integrated quality management system so as to reduce reliance of on-job trainings. So between 2020 to date, the country has expanded to take on board genetic sequence technologies to ensure that accurate diagnosis of HIV drug resistance, COVID-19, antimicrobial resistance, and diseases of public health interest, so as to facilitate surveillance and monitoring of these diseases. We have also embarked on enhancing laboratory biosafety and biosecurity to ensure safety of the laboratory, safety of the environment is the paramount. So in total, we have around 84 laboratories that have been accredited internationally to 3 different standards. So we have ISO 15189 standard that accredit clinical laboratories, whereby 74 have been accredited by end of last year. We have standard that accredit laboratory that provide proficiency testing or external quality assurance control, whereby we have 2 labs which are National Public Health Lab and CTRL accredited to the standards, and we have AFSBT standard that accredit blood transfusion services. whereby out of 9 centers that they do provide blood transfusion services in Tanzania, 8 of them have been accredited. So from the map, you can notice distribution of the accredited labs. Those that have been accredited at AFSBT standard, ISO 15189, and those that have been accredited by 17043 standard. So you can notice few regions, we still have few regions like Katavi that are yet to have an accredited lab in the region, and the majority and some of the labs that they have between 1 to 2 labs that have been accredited. So the majority of the accredited labs have been concentrated in the Dar es Salaam city. So you will agree with me that the implementation of quality management system has resulted in improved test accuracy, reduced test error, better EQA performance, stronger supply chain management, and more consistent reporting. Nowadays, we get testing performance reports, including commodity consumption on daily and weekly basis, which are accurate. So this is a tremendous improvement that the country has made. So at the programmatic level, these diagnostic excellences and quality assurance have contributed to the improved viral load coverage up to 98%, and the viral load suppression also up to 98%. So the turnaround time, as was previously said by our moderator Jacob, have also improved significantly to within acceptable times due to friendly and functional sample referral system and the laboratory information system with the automated return of the results. The country capacity to detect and respond to epidemics has also grown to an adequate level, and integrated quality management system, curricula into higher learning lab courses have greatly reduced dependence on formal trainings. So thank you so much. I would like to acknowledge the Ministry of Health, development partners like CDC, DOD, USAID, and the WHO, as well as Global Fund for their significant contribution to diagnostic excellences in Tanzania. Also implementing partners who are working in various regions and at the national level, including private laboratories, and as well as the President Office, regional, administrative, and local government ministry. Thank you.
Thank you so much, Temba, for the presentation. Next presenter is Dr. Nzovu Lenga. Is going to speak about resource optimization and technology leveraging. And we are going to see the Tanzania Diagnostic Network, DNO, which is Diagnostic Network Optimization, and challenges and opportunities as well. Karibu Daktari.
Good afternoon. I would like to take this opportunity to thank the conference organizer for providing me this opportunity to share the work that MDH have been doing for the last 20 years. But also taking this opportunity to thank the US government through CDC, who provided the support, both technical and financial, in the implementation of the work. But most importantly, I would like to take this opportunity to thank the government of Tanzania for providing tireless support and working hand in hand with MDH and other partner in implementation of the laboratory work. But personally, thank the CMO who have taken time from her busy schedule to come and be with us here and share her experience on the road to improving laboratory services in Tanzania. So today I'm going to present to you the diagnostic network optimization exercise that the country undertook in 2002 to optimize and increase efficiency and access to testing in Tanzania. As we all know, PEPFAR, through CDC and the other organization, has invested a huge amount of resources in collaboration with the government of Tanzania to improve laboratory services in Tanzania. You are all, witness. When you go around, you see laboratories that have been renovated through this support. You see equipment, modern equipment that have been installed and commissioned as a result of this support. You see countless of laboratory professionals who have been trained. You see systems such as QMS, sample referral, and other initiatives that have greatly benefited laboratory services in Tanzania. But around 2020, after scale-up of viral load and EID services, it was clear there was misalignment between resources, between testing capacity and demand. So today I'm going to share with you the result of diagnostic network optimization, which aimed at improving access, improving efficiency, adopting effective technology for multi-pathogen testing, and strengthening the sample referral. So the overview of my presentation today, I will focus on presenting to you the overview of diagnostic network optimization, the impact of diagnostic network optimization, then I will finish with a recommendation and the future direction. So basically, diagnostic optimization involves the diagnostic network integration that end up improving access, improving the efficiency and the impact of the services that are provided in the diagnostic network. And that is achieved through diagnostic integration, as well as maximizing the available resources in the network. So when one set out to conduct diagnostic optimization in a country, there are several areas to consider. And these involves collecting data on the test demands, but also collecting data on available capacity. And for Tanzania, which has a huge network running from the national level to the health dispensary level, you have to collect data on testing capacity available in each of these levels. But also you have to be able to tell what is the utilization of this capacity. Because it's clear that there were labs that have huge capacity, but utilization was also very low. And then develop model for analysis of this data, where now it should be clear to be able to tell where more equipment need to be placed, but also how other communities, especially those at peripheral, can access these testing services, but also which route can be utilized in sample transportation and which system can be used in providing results back to the patient. So for this exercise in Tanzania, the aim was to improve laboratory system by aligning demand with laboratory network capacity. But more importantly was to ensure that the existing sample referral have strong link between the facilities where the sample are collected, as well as the hubs. Hubs are the facilities that act as a collection center for the samples, where they're processed, kept, and then send off to testing laboratory. In the end, what we hoped was to optimize capacity of laboratory in Tanzania, reduce the cost of conducting or providing laboratory services in Tanzania, as well as improving the turnaround time. This is the time that it takes for a sample to leave a facility and receive the results back for clinical decision. And these are just the map that depicts the facilities. We have almost over 6,000 facilities that collect sample for HIV, early infant diagnosis, TB, and HPV. But we also have close to 300 laboratories that provide molecular tests for viral load, EID, TB, and HPV. So the goal here was to ensure how do we align these facilities that are collecting sample to the testing laboratory. What is an efficient way to get these samples to this laboratory? What will be the cheapest way of transporting these samples? So after conducting the exercise, and this was with the help from a consultant who ran all these models after we collected all this data, it was clear that Tanzania Diagnostic Network had sufficient capacity. As you can see on the chart there, when you just look at viral load, EID, COVID-19, and HPV, total sample per year was just above 2 million. But when you look at the actual capacity of the existing lab in Tanzania, and assuming that you are running them 24 hours, the demand coming from viral load, EID, COVID-19, and HPV, it's only a third of existing capacity. So in terms of capacity building, the country had made huge progress. In fact, the capacity existing was far more than the demand that existed. And that's the reason when it comes the time to roll out HPV testing, there was no need to establish a new laboratory. There was no need to buy a new equipment. There was no need basically to set up any sample referral system. Everything existed. It was just a matter of using the existing system. Apart from that, the DNO exercise, we are able to show misalignment. For example, 46 gene expert machine and about 10 conventional laboratory molecular platform were shown to be underutilized. Basically, these machines were placed in laboratory where the use was really below, almost 15%. But apart from that, the same exercise showed that it was important to add 3 labs because simply there were sample coming so far that when you compare paying for transportation to the molecular laboratory and establishing a new lab, in the long run, it made sense to establish new lab. So the exercise recommended to establish 3 new labs. This exercise also, it made possible to integrate the sample transportation, HPV, TB, COVID, into existing sample transportation. As I speak currently in Tanzania, you can use the existing sample transportation to transport surveillance sample, to transport the diagnostic sample, as well as outbreak sample and research sample. And now the government have engaged POSTA as a central coordinating and transporting agency throughout the country. So even if you have sample coming as far as in Kasi coming to Dar es Salaam, all you do is a matter of just making a phone call, a sample will be here, it will be tested and go back in time. So that's the work that we have been able to achieve in support with the government of Tanzania and development partners. So here is the few outcome of the exercise that we conducted. You all remember, especially for some tests such as EID, It used to take up to a month to get results back at the facility. As we speak, currently, on average, we are at 14 days, but we have labs now that are providing result in as little time as 2 to 3 days. And where we are going, our aim really is to achieve, turnaround time that is very, very minimal. Let's say, even in a day. At Temeke right now, once we finalize automation, the lab will be able to release results within 1 day. But also the uptake and capacity of laboratory around the country have increased as a result of this DNO. But as mentioned, we have a much stronger sample referral system that is able to transport all kind of sample from anywhere in the country to anywhere in the country. And the issue of stockout and equipment downtime have been well addressed, and this has been through reagent rental, which have gone a long way to control the cost of running these tests. As you know, laboratory testing, especially molecular one, are very expensive, and the service level agreement have helped a lot to reduce and cut costs for laboratory services. So now I'm going to finish by providing recommendation, because when we started this exercise, there was misalignment between demand and capacity. The exercise did a lot to minimize that misalignment, but misalignment is still there. And as we progress with new initiative, government initiative to expand facilities, government initiative to build new labs, these efforts, as much as they add capacity, they also introduce misalignment. So our recommendation is for the government going forward to build internal capacity to conduct these DNO periodically, choosing a period of, let's say, 5 or 10 years, allowing for the changes to occur, but also for the new technology to emerge, so that when you conduct this exercise, at the end of the day, you get meaningful outcome that improve services, improve access, cut cost, and they strengthen referral of samples from one area to another. But another recommendation that we have is to strengthen more on the work that the government have started, especially managing vendor, managing the contracts, on the issue of service level agreement, on the issue of reagents, so that once in a while we run into stockout and we do redistribution and address this issue. But I think going forward, if they can work to strengthen vendor management inventory system, it will go a long way to address this problem. And the last recommendation is to improve diagnostic efficiency and turnaround time through using the modern molecular platform that is able to test more than one test. It's no longer efficient to just use one platform for TB, one platform for HIV, one platform for HPV. One platform, the platform that are coming out right now, one platform can do up to 60, 70 different tests, and even some of them concurrently. And I think the government should be now moving in that direction. So with that, I would like to end my talk and thank everyone for your attention. Thank you so much.
Thank you so much, Daktari, for all that milestone that we have seen. Now, may I take this opportunity to welcome Mr. Ambele Mwafulango, the Acting Director for National Public Health Lab, to give us the laboratory voice, the impact of biosafety and biosecurity practices.
Good afternoon. As being introduced, my name is Ambele Mwafulango. I'm the Acting Director for National Public Health Lab. It is our honor to be invited for a talk, especially to this very important summit. I would like to acknowledge and thank you, the organizers, for this opportunity, but also the Minister of Health or the government of Tanzania for all those have been done, especially on the biosafety and biosecurity. I'm here just to give a vital voice. Our voice should be heard. And with that, today's voice, I will just give the impact of Roberto biosafety and biosecurity practice in the country. So I'll just have some few area which I will talk on. First is the overview of biosafety and biosecurity practice in Tanzania, and also the human resource capacity and capacity building on biosafety and biosecurity. Tanzania milestone on biosafety and biosecurity, impact of biosafety and biosecurity implementation, and also we'll have the way forward, the end. So why biosafety and biosecurity matter and what is all about? Let's just remind ourselves a few when we say biosafety and biosecurity. When we say biosafety, biosafety, we mean protecting people, environment from accidental exposure to harmful germ or biological material. But when we say biosecurity, we prevent the misuse, theft, intentional spread of dangerous biological material. So, biosafety and biosecurity, it protects about staff, patient, and community. Also prevent accidental or intentional pathogen release. Tanzania, we experienced some outbreak like the COVID-19, Marburg, and Mpox, and all these with the biosafety and biosecurity is now why you are getting result and you are seeing like, okay, we are testing, we are getting this result. You can do the testing, you can do, you can handle this dangerous pathogen if your safety is not taken into consideration. When we set the lab, there are a lot of things we consider in there. But if the safety is compromised, you can't do the testing on the dangerous pathogen. That's why we have those levels of laboratories. Safe lab, we say safe lab is equal to resilient health system. So if we have this lab, then we can do the testing and then we can get all those results. So we have like more than 6,000 medical laboratories in the country who are engaged or supporting the TB, HIV, and clinical services. And also 3 public health laboratories supporting outbreak investigation, and 5 BSL-3 laboratory. Those are the high-level laboratory in the country. But all this, how we achieve this one, you can see the number compared to how big the country is. You can see the number is small, but we are working through the laboratory network, which are linked by the integrated sample referral system. I think the previous presenter talked about a little bit on the laboratory sample referral system. So this is by using the hub and spoke model, but also we have a national guideline for direct implementation as per WHO standard. So apart from having this one, we are also using the WHO standards to make sure that we attain the biosafety or the biosecurity containment. Tanzania, of course, we implement biosafety and biosecurity in line with international and regional framework. That is includes IHR 2005. We have HSHA action package, which we call APP3. We have also UNSCR 1540, and also Biological Weapon Convention is BWC, and also biobanking practice, and African CDC Biosafety and Biosecurity Initiative, or we call those African CDC BBI. The country has completed the second JEE in 2023 and developed a national action plan for health security of 2024 and a multi-year planning process to enhance implementation of IHR core capacities. So after this JEE, then we have this national action plan to implement the IHR core capacities. Implementation is coordinated by PMO, Prime Minister's Office, and overseen by the multi-sectoral Safety and Security Technical Working Group. This coordination promotes a One Health approach with effective stakeholders engagement and cross sectors. So on this, we have to, on the issue of safety, we are considering the multi-sectoral. You are not safe if your neighbor is not safe. So let us see on the milestone of biosafety and biosecurity. We try to align with at least the 5 years which have been done, because before 2021 there was several things which was been going on biosafety and biosecurity, and you can realize before that one, even the testing, most of the testing was not being conducted in country. The samples either sending out of the country or whatever, but there was some measures being done. So before 2021, biosafety implementation at facility level was done as part of QMS or SLAMTA program to attain ISO 15189 accreditation. Is by general biosafety and biosecurity and biosecurity manual and the SOPs. So this was implemented there. But in 2022, National Multi-Sectoral Biosafety and Biosecurity Guideline developed, and also a regional biosafety cabinet classification training center established at together with Muhimbili University and National Public Health Laboratory. But only 36 biosafety cabinets were certified. In 2023, we participated in JEE, scored 2 of 5, that is limited capacity in development stage on biosafety and biosecurity at all government. Development capacity on the training. So we have some area which we have to develop, do the development, the capacity development for this one. The establishment of multi-sectoral biosafety biosecurity just after the JEE, and also East African Center of Excellence for Biosafety Biosecurity. So we also attained in 2023 the Biosafety and Biosecurity Center of Excellence training in our country. On 2024, 5 BSL3 laboratory implementing certification program for high containment laboratory under African CDC Biosafety Biosecurity Initiative framework, and 2025 establishment of inventory of dangerous pathogen, started development of biosafety and biosecurity legal framework. Also, we have one of our lab which have been assessed, KCRI, one of the BSL3 laboratory achieved a 4-star based on African CDC assessment. Validation of piloted method of treat liquid molecular waste containing GTC was also being done, and safety cabinet certification now increased up to 278. So with this milestone, you can say in terms of human resource capacity, we have regional biosafety and biosecurity certification training, the NSF Accreditation Center at MOAS and NPHL in 2022, as I mentioned, and also hosting the East African Regional Center of Excellence on Biosafety and Biosecurity, where we are serving not only our country but other 13 countries across the eastern part of Africa. Establishing the online biosafety and biosecurity training through ECO project in 2024. And you can see there are a number of staff who have been trained on biosafety and biosecurity, but at different levels. The highest number is on biorisk management level 1, which we have 316, but we have also a number of staff on basic biosafety and biosecurity, which is 79, but the other, you can see that. But the good thing we have the TOT, the biosafety and biosecurity training of trainers, which we have 24, which we can just cover to train almost that part of our country. So we have some implication after starting this, implementing this milestone, which our milestone and the implementation of our safety and biosecurity. First, we boosted public health protection, timely outbreak detection, and MVD, of course, example MVD and mpox. So we boosted protection on that one. So people are protected, and even the fear now for lab staff to collect sample has been minimized, in the minimal for those who are collecting sample. Reduce laboratory occupation incidents, and also strengthened biosecurity by ensuring safe pathogen handling. Like now, which we say that we are transporting all those samples using the same guideline, but those guidelines, they have instruction where we safeguarding the safety of, ensuring safety of pathogen. Improve the laboratory safety as a result of by safety cabinet certification. Now, before we used to have certifiers from outside of the country, but now we have enough biosafety engineers in the country, which also, some have been trained in country, but some are trained overseas. But also we have other trained staff from other countries which have been trained in the country. Availability of local human workforce towards sustainable TOT, biosafety cabinet local certifier. So we also have a local certifier, a compliance and credibility of the SL3 achieved 4 stars recognition by Africa CDC. So the way forward is to review the national multisectoral biosafety and biosecurity guideline to align with WHO biosecurity guideline 2024, WHO biosafety manual 4th edition 2020, and also to finalize development of biosafety and biosecurity legal framework and continue the process of establishing the inventory of dangerous pathogen, continue with certification of high containment facilities, and also build sustainable biosafety culture beyond donor support, implementing of GTC liquid waste management. Finally, I would like to just acknowledge and then sincerely acknowledge the government of Tanzania, who are giving support to make sure that the country is safe, the lab is safe, and all people are safe. But also the chief medical officer here, I can say that he played a very big role, because he started with this lab since she was director of curative. Then for her guidance, support, instruction, and also support for the lab. And also she was like a counselor. Whenever things are going difficult, then she was doing the counseling. So I would like to acknowledge on behalf of the government of Tanzania, also the chief medical officer. Thank you very much.
Thank you so much, Acting Director NPHL. It's truly indeed, we need to crown CMO as laboratory professional as well. Naye awe mtaalamu wa maabara. Okay, so next speaker, Dr. Msafiri Frank, is going to speak about laboratory readiness on emerging diseases. That's where we want to hear the whole impact, how has been affecting the emergence diseases response.
Good afternoon, everyone. Yes, I'd like to take this opportunity to present this talk on behalf of Dr. Mahesh, the CDC Country Director. So I'll be talking about the role of the laboratory, okay, in preventing, detecting, and also guiding the response to epidemics. So as you are all aware, no one in this globe is safe unless we are all safe. What we have learned from the recent epidemics, from the COVID epidemics to the recent Mpox and Marburg epidemics, is that the world is interconnected. So an epidemic in one part of the globe can spread very quickly to other parts of to other regions as well. So we need to work together to make sure that we contain the epidemic. And in doing so, we need to invest in a global health security. Yeah. So each country, okay, ideally each country must build capacity to detect and prevent the spread of disease, but in reality, very few countries globally have attained that capacity. So to be able to contain epidemics, the laboratory plays a very key role. The laboratories are the eyes of the health systems. They detect, they confirm, and they guide the response to epidemics. So recently, Tanzania has experienced 4 major epidemics. We have experienced the COVID-19 pandemics, and we are still battling the cholera epidemics for 3 years now. And we have also we have recently experienced the Marburg outbreak, okay, in 2023 and 2025, and we successfully controlled the outbreaks. So what we've learned from these outbreaks in the country, that the capacity which has been built over the past 2 decades, okay, by CDC and the government of Tanzania, has really helped us in controlling these epidemics and stopping them from spreading to other countries. So the lab plays a very important role. So the aim, whenever there's an epidemic, the aim is to make sure that we control that epidemic in a 7-1-7 framework. What it means is that a new outbreak, okay, must be detected within 7 days when it occurs, whenever it occurs. And once it is detected, the health authorities must be informed within 1 day, and the early containment, okay, the initial response must be completed within 7 days. So to achieve this, we need the laboratory, because the laboratory is at the core of the epidemic preparedness and response. So it helps us to, so when we are well prepared, it helps us to prevent, okay, so to confirm the presence or the presence of a new outbreak or emerging disease. It helps us to track, okay, the outbreak, whether the number of cases are increasing or decreasing, and also depends on the pathogen that is causing the outbreak. It also helps us to inform the teams how to manage the cases and to contain the epidemic. So far, a lot has been done in Tanzania. So over the past 21 years, okay, a lot of investment has been made in the lab. Okay, so CDC, in collaboration with the government of Tanzania, has trained more than 1,000, okay, fertile specialists. So we have at different levels, from the advanced level, intermediate, and the frontline levels. and they've helped us a lot in containing the epidemics at the source. So whenever there's an outbreak, it is very important to make sure that the outbreak is contained as quickly as possible. Moreover, labs have been capacitated to establish molecular and genomic detection capacity. The public health laboratories, our 4 public health laboratories can now accurately diagnose diseases and identify new pathogens very quickly. And we are going to see it from the experience, using the experience from the recent Marburg outbreak. We've also been able to establish a sample referral system which enables safe transportation of all samples for accurate and timely diagnosis. So the investment which has been made over the years has actually helped to protect the country. The recent evaluation that was performed by the WHO-led team, it's called a Joint External Evaluation Team, has actually shown that the Tanzania mainland is performing much better compared to Zanzibar. So when they looked at the different indicators of public health security, we're actually performing very well. And but like I said, no one is safe until you're all safe. So we need to do more for our counterparts in Zanzibar to make sure that they're also performing well, so that once they're safe, we are also safe. So what was the role of the lab in the recent Marburg outbreak? Okay. So from this graph, what you can see is that whenever there's an outbreak, we aim to contain it by using, I said, the 717 framework. So detection within 7 days, notification within 1 day, and then containment of the outbreak within 7 days. But what happened during the recent Marburg outbreak, if we can all see that the first case actually started showing symptoms in December 2024, and we had sporadic cases in between, but it took around a month until January for official notification to be made to the health authority. So there was a delay in detection. So the surveillance system, there was a gap in detection. But once the notification was made, the laboratory confirmation was very quickly. Within 48 hours, we were able to confirm the outbreak. And the outbreak was contained very quickly within 5 days. So we can see from this that we need to do more to strengthen the surveillance system. So we are doing well, but we still have areas to improve. And one of them is to make sure that the laboratories work together. The laboratories in all sectors, in human and animal, in animal sectors, to make sure that we detect early the outbreaks. Also, we maximize the utilization of the few resources that we have. Moreover, we should build more capacity for characterization of the pathogens. Okay? So genomic surveillance system is very important. Also timely data reporting and sharing. And also we must build local capacity to ensure sustainable funding for laboratory commodities. Okay. Most important now is that to have a resilient health system, we need now to move from detection and responding actually to predicting and prevention. So if we move to that direction, we will strengthen our public health security. Thank you.
Thank you so much, Dr. Frank Msafiri. Now we have had all the investment and we are calling up for sustainability. Now, may I take this opportunity to welcome Dr. Grace Magembe, the Chief Medical Officer, to speak on the sustainability plans and strategies.
Good afternoon, everyone. Unfortunately, I was not told that there's a presentation, so this one is going to be a bit different, but I'm sure we're going to get along. So let me start by thanking all of you for inviting me to this very important forum. And I do acknowledge all the partners who are here, but also colleagues from the government and other non-state actors, implementing partners. Good afternoon once again. So as I think it was Ambele who said that I'm very passionate with diagnostic services. And diagnostic services includes both the lab, imaging, as well as radiology. That's how it is classified within the health sector. And why am I passionate is because I think this is the only, these are the only services that differentiate between us and witch doctors. I hope I'm right. Yes, for those who have been to witch doctors, I don't know whether you've been there or not, they also take history, right? When you go there, they ask you, why are you here? And you start explaining. They also expound the history. They go even to the family social history. Yeah, they will tell you, you know what? That brother of yours, he's behind this. So they do all that. The only thing that they cannot do is to prove whatever they've told you. And we have that capacity. And where do we get that capacity? It is from diagnostic services. So that's why this area really has been very close to my heart. And I would say it's a key function within the health sector. Without the lab, without imaging, without radiology, then there's no health sector. And it is also true that laboratory services, actually, they remain as a backbone of both preventive services, clinical services, treatment, as well as surveillance. My colleagues here have said a lot. I wouldn't want to go back into that. And we've had experiences in the past, and even now, during the outbreak, during the COVID-19 pandemic, but also recently we had outbreaks of Marburg, okay? We've had outbreaks of anthrax in the past, you know, they are on and off, okay? Talking of Mpox and so many other health emergencies that happened not only in Tanzania, but also globally. But to me, laboratory services, they go beyond supporting the diagnosis or prevention of only infectious diseases. Even with non-communicable diseases. Now we are increasingly seeing the importance of laboratory investigations in terms of supporting or managing non-communicable diseases, which are posing a big threat in our healthcare system. But in blood safety, for those who know the history of blood services, blood transfusion services in this country, you know, those areas are gone now, but I think they will still be in our history when we could not really assure the patients who are coming to our facilities seeking for blood services whether the blood that we're providing was safe enough or not, okay? But gone are those times. And we have also seen the importance of laboratory services in One Health approach, okay? We need lab, whether in human health or in animal health, because there's a lot that we share between us and animals, both domestic as well as wild animals. So that's why I was saying that, you know, laboratory is very important. And Ambele, thank you so much for appreciating my support towards the national lab. I know it wasn't an easy process. Yes, I remember I was the director of clinical services, which by then was also overseeing laboratory services. So he said that at least he appreciated that apart from everything that I did, was also to cancel them. I was just about to ask him, who do you think was canceling me? Because I, I also needed that canceling. But I'm very proud and I'm very happy to see all of you and where we are. We've come a long way, and I know that we still have a long way to go. So a lot has been said with my colleagues, so I wouldn't want to repeat. Mine is to chart a way forward on how we can ensure that all the achievements that we've been able to achieve together as partners, the government and our esteemed partners, how are we going to sustain them? I think that's a question that all of us should be asking themselves. Yes, it takes the government, but who is a government? Both, me and you, okay? And just to start, I would say that laboratory services are well reflected in our strategical framework documents, both the Health Sector Strategic Plan 5, okay, which is soon to be reviewed, but also the universal health coverage. Lab services are featured there as very essential services, but also for those who have looked at the 2050 national vision, okay, laboratory services also have been reflected there. And this is one way of ensuring that we sustain these services, we sustain the gains that we've been able to achieve. And by 2030, we are looking at having all zonal and national laboratories achieving accreditation, you know, at least having achieving international accreditation, and laboratories coming from primary healthcare, especially those from district level, at least achieving a 3-star WHO rating. So that's what we are visioning as a government. And talking of the lab services, would really wish to see that by 2050 we have a full self-resilient diagnostic network, okay, supported by local manufacturing, sustainable financing, but also renewable energy and a strong public-private partnership. And recently, I think you witnessed, we signed an MOU with Abbott Laboratories, who are looking forward to putting up a production plant within Tanzania. We've made progress in that area, and I think soon things will start, you know, taking shape. And what we want is to address, one, the availability of such commodities in the country. When my colleagues were presenting here, one of the areas they mentioned as a challenge is erratic supply, you know, out of stock of so many other commodities that we have. So we believe that having a production plant within the country is also going to address on that. But this will also address another challenge, that is the, employment. You know, we have lab experts in this country, you know, skilled in various areas of laboratory, but maybe they're sitting idle somewhere in the streets. So I think this is also going to be one of the ways that we're going to be addressing that challenge. And on the side of the government, we've started, you know, vigorously the application of renewable energy. I would cite two examples. One is MSD. MSD now are transitioning to solar, okay, as opposed to electrical energy, which is a bit expensive, but also the IVD program, okay? I'm sure you know where our storage is, so we are also transitioning to solar. So as we also continue, I think, to address this one area, we are also looking at how can we also transition into solar energy. And there's no way you can address sustainability without embracing the private sector. Yeah, the government has never been the only solution, and it will never be the only solution. One of the biggest tasks of the government is to provide a conducive environment for the private sector to flourish. So that's also an area that we are looking at, you know, to make sure that we sustain these laboratory services, digital transformation, but also AI-based diagnostic to ensure that we have equitable access to diagnostic services, and we improve our efficiency, and we also have a robust surveillance. As you may all understand, talking of surveillance, we are also talking of community-based surveillance. And communities are always very far from where the national level is. So if you do not have systems in place that can bridge this gap, you know, that can transmit information timely for time decision making, it becomes very difficult to respond, but also to predict, you know, what could be the next outbreak, etc., etc. So I would really want to share with you a few issues or areas that as a government we think that, you know, focusing on them, they can also be of assistance to all of us in terms of ensuring sustainability. One is, as I said, local manufacturing. This is an area that we cannot avoid. And also sourcing of laboratory commodities. Of course, we can't be self-sufficient like tomorrow. Okay, we'll continue sourcing, but how do we work together to make sure that we have yes, we source, but where do we work together, the government and the partners, to ensure efficiency in our sourcing of commodities, public-private partnership, and also embracing innovation. But I'm glad that we are now looking at how we can also harmonize the different donor-supported programs. My colleagues here spoke. We even have machines now that have different platforms that can help us, you know, do a number of tests using the same machine. I think that's what we should be looking at. Those are those days whereby each intervention was looking at how each intervention can make use of a different machines. I think a lot has taught us, including the changes in global financial mechanisms that have changed. I think that should be enough to teach us that, you know, efficiency, but also integration is the way to go. And they've talked about the integrated laboratory network. Okay, with harmonized standards, but also standardization of equipment, as well as other supply chains. That is not avoidable. So as we sit here and discuss and deliberate, that's where we should be focusing, because all those are components of sustainability. But one of the very important resources that we need to really focus our efforts in terms of capacity building is the human resource. Things are changing every day, okay? We need to train our staff on good laboratory practices and so many other skills that they need, and which are also changing from time to time. So it's also important for us to look at other training strategies, you know, not necessarily the classroom or the physical trainings, but we can see on how we can have a modality, a hybrid modality, okay, just to try and cut down the cost that we're incurring, but without really underestimating the quality of our staff. And the other thing is regional as well as international collaborations. Tanzania cannot exist in isolation. Okay, so it's mandatory and it's important that we collaborate with like-minded, okay, other institutions globally that are also in the same business, to make sure that, you know, we also learn, but also we leverage on skills that are out there, or institutions that are already existing out there. So what have we done as a government in terms of making sure that all this that I'm talking about actually is well aligned with within our sector strategies and other government frameworks? So if you look at the Health Sector Strategic Plan 5, which I said is soon to be reviewed because I think it's ending in 2026, and we are all here, I think this is also an opportunity for us to make sure that we review it. I think it has come timely when things are changing all over, to make sure that these things that we are talking about are also reflected in that strategy. So one, my colleagues here talked about the cost that we're incurring in terms of accreditation and certification of our laboratories. Currently, we rely heavily on external accreditation. I think we've been using Kenas, SADCAS and the like. As a government, we've started a move, and I'm calling upon all of you to support this move. We need to have our national accreditation body within the government of Tanzania. And we've even come up with a name. I mean, there will be room for change, you know. We're thinking of having a TANAS in this country. This will cut down the cost, but it will also help us to scale up these gains to other facilities. I always tell people, yes, you may think of the national laboratories, you may think of the regional ones, but every Tanzania who comes to seek for health services, no matter where they go, even if it's at a dispensary level, they need to be assured of the quality of laboratory services that they're getting. But the way we are moving right now, I don't know when we'll be able to cover almost 10,000 facilities in this country. Because all those that have been covered, they're just a handful, okay? So the best way we can do it is to make sure that we support this move. We have our accreditation body that, you know, will help us move faster. So that's one. And the other thing is expansion of our infrastructure across the entire country. I remember those days when we put up a structure, let's say a health facility, a lab or an imaging facility will be the last one to be constructed, and you wonder, what is that hospital doing without a lab, without imaging services? So we're all witchcraft somehow, but thanks God we managed to move out of that. So now, having a lab in place, having an imaging facility or a radiology facility is a must for a facility to start operating. Short of that, it can't operate. It can just provide, you know, essential services like vaccination and stuff like that, but they will not be allowed to provide any other services. So I'm looking at, we are expanding infrastructure and equipment across all facilities, but also, as Mbele said, we are strengthening the national lab. I know there's a lot of interest in that, and we welcome those good ideas because that's where we should be going. This is our national reference lab, so we have every reason to invest in that lab, and thanks to all the partners that have shown interest in that have already engaged with us in supporting this lab. It's very important that we make this lab to be a hub of biosecurity, you know, biosafety, but also reference testing during disease outbreaks. The other thing is scaling up laboratory information system. This will also help us with data for timely decision making, but also expanding antimicrobial surveillance to subnational as well as in the private sector, in alignment with the global action plan. Okay? This will also reinforce our capacity in terms of surveillance, but also disease monitoring and control. It is evident that we cannot survive on our own. Thanks to the One Health approach, where we've brought on board colleagues from the animal sector, colleagues from the agricultural sector, and other stakeholders, because we are now seeing across infection, you know, that is happening between animals as well as human beings. And most of the diseases that are, you know, are really classified as of public health importance or global health security, they originate from animals. And there's no way we wake up in the morning and say that today we are preventing interactions between animals and human beings. We can't. For those who went with me to, I think it was Kagera, during the Marburg outbreak, I think George Mgomela was there. When we were there, actually people were happily interacting with chimpanzees there, gorilla. I mean, they're not even, you know, worried what is going to happen. Because to them, they go there, they are busy with their activities to make sure that they earn a living, you know. So we cannot avoid that. But how do we prepare, you know, in case anything happens, either today or tomorrow, because we don't know when is the next outbreak coming. I think the first Marburg outbreak was in 2022. Yeah, and 3 years down the line, we got another outbreak. So it's important for us to be prepared well in advance, because these outbreaks are real, and they'll keep on happening. So having said that, I really want to thank all of you for this forum. I think it's a forum that we really need to take advantage of, discuss, and agree really from here, where do we move? As a government, we've already laid a foundation, okay, at least which priority areas, which areas would really want all of you to focus or to invest. But I just want to assure you that we are more than ready as a government to sustain all these gains, but also to allocate resources. I think some of you are also aware of this. Even some of the commodities, we were able to set a budget of almost $42,000, okay, to try and bridge the gap that happened. But I believe this was supposed to be the spirit, since that time, okay? But we are not here to point fingers at each other. We have a place, we have a starting point. Let's start there and continue. So thank you very much, and I'm looking forward to a very how do I say it? Vibrant discussion, but which is very focused on how we are going to sustain the gains. As I said, in this sector, you cannot do without diagnostic services. And diagnostic services, not only for clinical services, but also for surveillance, but also for alerting us and preparing us on how to respond to the current as well as the coming or the future disease outbreaks. Thank you so much, and thank you to all the partners who prepared this forum. Asante. I did not apologize for walking out. I mean, this is very unusual for a panelist to move out and to pick a call. Forgive me for that. It was something very pressing. I couldn't avoid it.
Thank you so much, CMO. And during the presentations that we have heard today, we have seen tremendous improvement, including in-country capacity, CMO, that we have built to certify about safety cabinets, of which other countries are buying the services outside the country. And we are very grateful to see the importance of establishing the Tanzania accreditation body here in Tanzania, where we are paying a lot of money outside the country. So all those are the sustainability initiatives. And the other good thing that we have seen during the presentations is the operational sample transportation systems. And we are using POSTA right now, Daktari and all the presenters. Those are very tremendous improvement for the country and for sustainability as well. So we are standing between you and your lunch. So we are going to allow 3 short questions, because when you ask, just remember the lunch is served upstairs. So just ask 3 short questions, and we are going to invite our panelists to respond. Karibuni sana for burning questions. That's one. The one who is moving the mic, there is one hand. We have mics here.
Thanks to all panelists for very great presentations, to giving us an understanding of the laboratory diagnostics. My name is Harriet from Tanzania Health Promotion Support, and I'm just going to take you a little bit back to the theme of our conference, which is harnessing data and technology. So wanting to ask, how are we planning to, or how are we currently harnessing data, technology and innovation in general towards, improving efficiency of diagnostics? We know that currently we have AI, you have big data, machine learning, etc. And there is a lot of work that is ongoing even in the ground to sort of utilize this data to in enhancing early detection and the like. So how are we taking into consideration of this component? I think I somehow didn't hear this. And the second question is, so we as the government and implementing partners, how are we collaborating or whether leveraging the expertise from the private sector in improving diagnostic quality and efficiency? Because we know in terms of the equipment, the expertise like knowledge, etc., we know that we have companies, within the country and outside that are doing quite well. They have a quite quick turnaround time, etc. So how are we leveraging this expertise to build the capacity and improve diagnostic quality and efficiency as the government and implementing partners? Thank you.
Thank you so much for 2 questions. And we have the last 2 participants will have their questions. So we have the last 2. The gentleman in suit and the lady. Yes. So
thank you very much, panelists, for the nice presentations and showing us where we are and where we are going. So I would love to talk about data. Sorry, my name is Doreen Kalanga and I'm a lab scientist at the National Public Health Laboratory. So I have a question. We have several laboratories in our country, public and private, and all of them I know they're serving our customers, or we can say the community. But we have different laboratory information system. As I was going to ask, do we have a plan that is going to integrate or harmonize the laboratory information system of different laboratories from public to private, so that we can have an information or I can say a large number of data that can help us to study where we are in terms of the diseases and where we're going, because we can see as we're going on, a lot of the diseases that are coming out that has been there in our environment, and for some point we have not been able to kuzitambua before they come out. And also, an additional question is in terms of the diagnostics. Thank you, though. Nzovo, you talked about advancement of the machines. I have one question about GeneXpert. We're using the GeneXpert platforms, but I believe we have LAM right now that is under trial, but we could advance on GeneXpert for diagnosis of TB, on immunocompromised patient, on the patient themselves. Don't you think that we can move this platform from GeneXpert to the machines that are more advanced than GeneXpert machine? Thank you.
thank you. The last one.
Thank you for the opportunity. My name is Hakim Idris. I come from the East African Community Secretariat, and I'm the Senior Medical Laboratory Officer. Thank you for the good presentation. It is very informative. I have 2 basic questions. The first one is on the role of Tanzania as the EAC Regional Center of Excellence for Biosafety and Biosecurity. And the question is, how do the other partner states benefit, or what plans do Tanzania have to benefit the rest of the member states or partner states in providing the service of biosafety and biosecurity? And then the second one is in the form of a question on the proposed establishment of the Tanzania accreditation body. It's a very, very good concern that the cost of accreditation is very high across the region, and specifically also in Tanzania. My question is, how do Tanzania favor the formation of a regional accreditation body compared to a national one? because, yeah, we talk of Kenas, we talk of Sanas. How will Tanzania favor if we create because we do not have a regional accreditation body in East Africa. So there are many, of course, I know, nationalism, regionalism, but this is just some of the question for thought. Thank you very much for the opportunity. And I really appreciate participating in this meeting. I think the East African community should be fully participating in this meeting regularly to get the real updates on what is happening in our partners, especially in Tanzania. Thank you very much.
Thank you, my brother, from EAC. And we have 3 questions that were just posed without speaker. So the first question on the use of data, technology, artificial intelligence on decision making, that one I'm going to pose to Dr. Nzovu. The use of data, artificial intelligence and technology on decision making, and the private partnership engagement on improving laboratory services. I'm going to pose that to, I'm sorry, I don't want to do that, but I'm going to pose that to CMO. The engagement of private sectors in improving laboratory services. And Doreen asked about, we have a number of laboratory information systems. They are not integrated. How best the ministry and the country is doing to integrate all these laboratory information systems. I wanted to say I can pose that question to myself, but I'm going to pose that to Ambele and to respond. And I know that the ministry has done a lot, including establishment of Health Data Universal, HDU, which will integrate all the laboratory information systems. So welcome. I'm going to start with Nzovu, and then Ambele, and then we are going to finish with CMO, while we are thinking on how Ambele also going to respond on Regional Center of Excellence. CMO is going to respond to the other question of TANAS.
Yeah, thank you. Thank you for asking that question on the issue of data. So when you look at health information system, Tanzania is one of the countries in Africa that have made significant progress. As we speak here, in big hospital, every hospital visit is recorded. But more importantly, every single laboratory test, starting from sample collection, sample transportation, sample registration, testing, and result feedback, it's all recorded, meaning that the country have developed digital systems for recording samples from collection all the way to testing and results feedback. And we started with different systems, but as we progress, we are bringing about integration, we are bringing about interoperability, such that these systems are able to operate together and data are deposited at national database. So what does that mean in terms of adoption of AI? As you know, we are sort of like in the midst of AI revolution, and laboratory is not behind. When we talk about diagnosis, currently in Tanzania, there are hospitals now that are using, remote imaging to be able to tell whether a lesion is cancerous or not. And some of it is AI aided. Moving forward, where we are going, not only we rely on AI in terms of diagnostic determination, but the actual operation of lab will be AI enabled. If you go to Temeke Hospital today, we are setting up an automated system for laboratory testing, where basically there will be minimal interaction between a sample being brought in the laboratory and the actual testing process all the way to testing. Everything will be done by machine. From basically you bring a sample in the lab, you just drop it in the bin, the machine will be able to collect the sample, look at the quality of the sample, process the sample, load it in the machine, process it, and report it, and store the remaining sample. That is actually will be done maybe in a month or so at Temeke. And all these machines, basically, they are being done, they are being operated by computer. Having said that, we can start those at high level, at the level of Temeke and the level of National Lab, but it will take a long time for that kind of technology use to trickle down all the way to the community level. So, issue of data, the Tanzania, the Tanzania government have done tremendous investment, but we have started slowly adopting to AI technology, and it will expand as we move forward. There was one question on the gene expert. I don't know if I should respond or.
No, it's fine.
Okay.
We are going to conclude that at the end.
Thank you.
Welcome Wambele. We have laboratory information system and how the member states are going to leverage on the regional center of excellence.
Okay, thank you. Starting with the different laboratory information system, which is a challenge in our country. As of last year, I think we have like a 30 laboratory information system across the country, which been supported by different partners in different region, and not only in the region but on different facilities. They get supported on that one. So before that, this challenge was observed, and one of the issue which was raised and is given to Ministry of Health and National Public Health Lab to come up with something which it can have a system which can integrate all these laboratory information system. So through the support from the government, of course, it was I think COVID funding. We started this national laboratory information system, and the specification of it was like it should have provision of integrating other system in the country, so that at the end of the day we should have a dashboard maybe at the Ministry of Health where they can just do a visualization on that one. So the first phase of that one has been developed. But now I think it needs some more to at least to have those to start integrating with other labs. So this is where we are. So we started it in Mabibo, our HQ, and now we are linking with our facility here in Posta, the one at Nimri, and then after successful of this one, then we can start going with Zono and other specialized lab to see if this one will work. At least we'll, if not cover the whole challenge, but it will serve at least to a certain extent. This is addition to what Jacob has responded previous. But coming to the member state, how they benefit from the Center of Excellence for Biosafety and Biosecurity. Of course, this Biosafety and Biosecurity Center of Excellence was established as a competitive chance. So we had a competition with us other East African countries, and of course we came up as a winner, of course, for that one, which was under the African CDC. So that Center of Excellence is supported with African CDC. So other member states, like now we had like 4 training, which was involved East African countries, and in African Union or in African CDC, they have this what's called the Eastern Africa, which we have 14 countries. So we held a training with 14 countries in 4 different training, including the safety and the security, like 3, and other the waste management for those countries. So, but also the country can have, they can decide to have a training, but we offer the venue and all the support from there. So we can have our training inside the country, but we can even support if it's not ours, because that is the center of excellence not for Tanzania, but for the East African community. Thank you.
Thank you so much for your response, Ambele. And just to highlight is this center is locally available, is for all East African member countries, and it is affordable actually. Participants, they can just pay for their travel, and we have subject matter experts for the trainings. Thank you so much, Ambele, for the responses. Come back to the gene expert question. I just want to highlight to you that the Ministry of Health has established standardized guideline for equipment standardization. So in order to introduce any new equipment, we need to go along with that guideline. However, your recommended input is taken on board. I'm aware that the team is here to see and analyze the other new equipment that are on the market. Thank you so much. Karibu CMO, and after your response, you are going to airisha symposium yetu.
Sawa, so asante Mbele, but again, I should thank my colleagues who started responding. So allow me to respond to what was tasked, but also to touch a bit on something else, which was raised by my brother from, is it EXA or EAC? EAC. I always meet you in Arusha, so I'm confused between EXA and EAC. Yeah, so one is how are we leveraging on the availability of the private sector in terms of improving diagnostic services, but also improving our efficiency. As I said before, the core function of the sector, of the Ministry of Health, is really to provide or to prepare guidelines and standards that do favor the participation of the private sector in health service delivery, including laboratory and other diagnostic services. And to do that, we are doing the following. One is MES, Managed Equipment Service. Okay, so this is where the private sector comes in. They bring in their technology. Okay, and that technology is being used in any facility, being it a private or a public facility. We have a lot of example in that area, especially with our National Blood Transfusion Program, but also a number of other laboratories whereby the government did not necessarily go, get money to buy those machines, but they're there run by private sector, under certain terms and conditions that do favor both the government as well as the private sector, because at the end of the day what we want is accessibility of services to the people that we are serving. But the other one is one of the examples that I cited, the MOU that we've entered with Abbott. Okay, the government would have decided to do that, but no, the government cannot do everything. So now it's Abbott who is going to do that business on behalf of the government, and through the PPP guideline that has been provided by the government, we have individual health institutions, including our national and other tertiary hospitals, that have entered into MOUs or collaboration with the private sectors or private providers of laboratory services, Lancet being one of the examples that I can cite. So it is being implemented, but the ministry is really implementing its mandate, which is providing policies and guidelines that promote or facilitate private partnership within the country. Now, with our request or our move towards establishing TANAs, this does not mean that we are not interested in supporting the regional accreditation body. No. Okay, as I said before, we wish, to accredit all our facilities from the primary health care all the way to the national level. And you can imagine the amount of cost that goes into that. So the aim is to make sure that, we reach each and every facility, but we still continue supporting the regional one, because that can also serve as a reference, Okay, you can't prepare the exam and examine yourself. Okay, so the role of the regional accreditation body will still be there. Okay, as a reference one. So we are member states and we are committed to any initiative that is put in place by the member state. Touching a little bit on what my colleague said, on how really we can have all these different lab systems speaking to each other. Okay, so one is trying as much as we can, which is we're doing now, to avoid, coming up with lab systems that are disease specific. Okay, because that also brings a lot of other chaos. We are integrating, but where we cannot integrate, I think at least interoperability, because there's some conditions or some labs, lab systems you cannot do without, okay? But how do you make sure that, they speak to each other? So we are also going for interoperability. But if you look at the EHMIS systems that we have now, both GoToOMIS at the primary health care, but also EMS, I think at the regional level, and there are also some at the national level, okay? We have put platforms, okay, that can also speak to other lab systems. So I hear your concern, but this is work in progress, but also it has to be individualized, and also looking at the context, which lab system does what, and if that one is integrated, what is going to be the benefit or the challenges. So that is work in progress. There's a mapping that is taking place now under the support of both the Minister of Health, but also PORAG. And as we move forward, maybe we are now aiming at reducing the number, okay, before we can say that we have one system, which I don't know if it is also possible, because there are also pros and cons for each option that you take. Yeah, I just wanted to contribute to that. Thank you. Oh, I thought he has something to contribute. So I'm supposed to funga the kikao. Okay. Okay, maybe I stand. Okay, so again, I think mine is to thank you. It has been a wonderful forum for us to reflect on the progress, to share the challenges, but also to chart a way forward, okay? As the theme of the forum was, what lies ahead of us now is how do we make sure that we sustain the gains? To me, that's key, okay? And how do we elevate lab services from where they are to another level? And for that to be done, I repeat, the government cannot do it on its own. We need each other. I know there's so many pending issues that we need to accomplish that are already on my table. Wangechi is not here. If she was here, she would have asked me. There's this letter with 1, 2, 3, 4, 5. I'm aware of everything, and I'm just waiting for the right opportunity to do it. Wangechi understands with George what is the right opportunity in this context. They do understand what it means. But as a government, we are committed, and we are very proud for the progress that we've made, and we see there are a lot of opportunities for us to do better and to do more. Okay, so that's the assurance that I can give all of you. Having said that, thank you for your participation. Thank you for the organizers and my colleagues, the panelists. Thank you very much. I was also learning some of the things. Don't be surprised. I was also learning. We never stop learning, yeah? Yeah, you keep learning. Even when I don't know which level you'll attend, and then you say, today I've stopped learning. We keep learning. So asanteni sana, and wish you a very good day ahead. Asante.